for allowing me to present to you about a very important topic that is dear to my heart. I'm encouraged to be able to provide as much information as possible to you so that you fully understand the truth about hospice care. My goal this afternoon is to try and eliminate any barriers or misconceptions that you may have, if any, and teach you about hospice care. It's nothing to feel anxiety or fear about, but to be embraced when the care is needed. It is in no way means to an end, so let's get started and make you feel a little more comfortable about this subject. Hospice, is it good or is it bad? Hospice has a negative connotation within our community, especially among our Hispanic families. There is a lack of education regarding what hospice care really is. There is a cultural fear of speaking or even thinking about hospice care. A little about me. I've worked with a local nonprofit agency for almost 6 years now. I have spoken to families and patients about their fears, concerns, and wishes regarding their end-of-life care. I have also experienced the death of a loved one, and I know how hospice is a tremendous help to the patient and the family. So what is hospice care? According to the National Hospice and Palliative Care Organization, the definition of hospice is comfort care provided to someone that has been diagnosed with a life-limiting illness or injury with a prognosis of living 6 months or less. Hospice care aims to help patients and family members improve their quality of life by addressing physical, practical, emotional, and spiritual needs associated with the illness. It incorporates a range of services offered by medical professionals as well as volunteers and caregivers. Today, hospice care provides compassionate comfort care for people in the last phases of an incurable disease. Death is a natural and eventual process, and that is best planned for. The goal of hospice care is to be able to address some of those issues that patients will encounter at the end of life. Pain relief and symptom management, it integrates the psychological and spiritual aspects of care, provides a support system to help an individual live as actively as possible, a support system to sustain and rehabilitate the individual's family and provide bereavement care. It affirms life and regards dying as a natural, normal process. Neither it hastens or postpones death. There is a team approach to address the needs of patient and family members. It enhances the quality of life and may positively influence the course of the illness. So what does hospice care include? As I mentioned, it incorporates a team support, and this team is an interdisciplinary team of physicians, nurses, social workers, spiritual and bereavement support, in some cases therapists, dietitian that addresses nutritional needs, durable medical equipment, and medications provided that are related to the diagnosis, and of course our volunteers. How important is hospice? Knowing what the hospice benefit really is and understanding the importance of hospice care at the end of life and all the support it provides to the patients and their families. Next, I'm going to talk to you about some myths and misconceptions that a lot of people have that don't know exactly what the hospice benefit entails. The first one, hospice care is only offered to people with cancer or elderly people. The reality is hospice care is appropriate for any age. Patients who have a life-limiting illness or a chronic illness that is not responding to treatment and or have determined they no longer want further aggressive or curative treatments, as I mentioned, regardless of their age. And cancer is not the only illness that is life-limiting. I've listed a few other diagnoses that would qualify a patient for hospice if needed. The next myth, I will no longer have control or independence if I agree to hospice care. In reality, is helping you maintain your independence and improve your quality of life are top priorities of hospice. Respecting your wishes and offering options and choices are a few of the many goals of hospice. The next myth, hospice care is another term for euthanasia, or they dope you up with narcotics and opioids and you sleep until you die. The reality is hospice care is about coordinating medical and psychosocial services to optimize the comfort and improve the quality of life for the patient. The definition for euthanasia is the assisted death of someone who would prefer to die. Hospice does not do that. In continuation, another reality is with some diseases there may be a high level of pain, and with other diseases there isn't. If your disease causes severe pain, you may be treated with narcotics or opioids, but only if you need it and only in the dosages you need. The goal is to make you as comfortable as possible, not to dope you up. So at this, I've gone over a few things about hospice, so you're still probably thinking, so why hospice? Again, hospice main goal is to improve the quality of life. It provides an interdisciplinary team made up of the dedicated and compassionate medical professionals and volunteers. Most importantly, it brings a lot of benefits to the patient and the family. It provides peace of mind, allows caregivers to rest, and empathy for what the patient is going through. So, a little more in detail of what the hospice care team, what's included with the team. Physicians and a nursing staff of nurses and certified nursing assistants to help provide the clinical needs and focus on pain management to alleviate pain and comfort care. We have our social workers and spiritual support that are available for those that need assistance with advanced care planning, community resources, addressing any spiritual needs, or provide support through the grieving process. And then we have our volunteers, which provide support for companionship, assist with running errands, allowing caregivers to rest, and giving peace of mind by providing the extra helping hand. So today I've spoken to you about what the hospice benefit really is and understanding the importance of hospice care at the end of life and all the support it provides to patients and their families and help eliminate any fears or misconceptions. So now we know the definition of hospice, which is comfort care provided to someone that has been diagnosed with a life-limiting illness or injury with a prognosis of living 6 months or less. We went over some myths and misconceptions about what hospice is and the benefit of having hospice care, which is, again, the main goal to improve the quality of life and providing that interdisciplinary team for comfort and support. So you might be asking yourself, what can I do? How does this benefit me? Well, as I mentioned, death is a part of life. We'll eventually all go through it. Most people fear death because they're scared to die in pain or to die alone. Hospice care can help prevent these fears and allow patients to have a dignified and peaceful death. Now we know what hospice really is, so I highly encourage you to help pass on this information that you've learned today to help educate your families, your friends, and anyone in the community about hospice care. And having that conversation with your loved ones early on to know what their wishes and their wants are at the end of life. Most importantly, no one should ever fear of dying alone or in pain. So remember, when in doubt, ask questions. We're here to help. There are many agencies in the local community that can provide this information for you. Any questions? Thank you for your time.
Thank you.